Dehydration is a gift at the end of life. In this video, I'm going to explain to you why dehydration helps us at the end of life. How does our body do it? Why does it help us? And what can you do about it? If someone you love is getting towards the end of their life, the first thing you will notice is that their eating and drinking starts to decrease. And of course, the first thing people start thinking is, what do we do about this? How do we make them eat more? How do we make them drink more? Do they need an IV to get IV hydration? Aren't they dehydrated? This question is asked to me almost on a daily basis working as a hospice nurse. Our bodies will naturally dehydrate themselves when they're getting towards the end of life. Our bodies know they're getting ready to die, and they will start helping us along the process. And dehydration is one of the things that will help. Now, there are things you can do to help your loved one, which I will get into later in the video. But first, let's talk about how and why our body does this and why it actually does help us. At the end of life, our bodies are naturally trying to shut down, like I said, over and over and over again. So the less we mess with that, the better the person is going to feel. When someone is very close to death in the actively dying phase, they're not taking in any water at all. And the reason why they don't feel extremely thirsty or like they need the hydration you'd think they would need is because their body is going into something called ketosis. The more we allow that to happen, the better the person will usually feel, because ketosis is a natural part of end of life. We want them to go into ketosis because that will naturally release endorphins for them, dulling pain, dulling sensation, and actually making them feel good. But what would actually happen if we did hydrate them, right? So that happens a lot. Someone goes into the hospital because their loved ones think they're in trouble and they say, hey, my mom hasn't drank any water for 3 days. If you take them to the hospital is going to do something about that. The hospital will put an IV into that person and they will try to hydrate that person. And if someone is truly at the end of life, 9 times out of 10, or maybe 9.9 times out of 10, their body will not handle that fluid. Even if we want to hydrate that body will not let the hydration work. What does that look like? The IV goes in, they hydrate the person, their body will start third spacing, which means the hydration will not stay intravascular, it will seep out, causing swelling, usually starting in the legs, then maybe the hands, and then eventually the person will start getting short of breath because the heart is trying to pump all this fluid that the heart and body is saying, hey, we're at the end of life. We're not supposed to be having all this fluid. So it tries and tries and tries. Eventually it can't do that. So it backs up into the lungs and causes respiratory distress. If someone's in respiratory distress in the hospital, they will get intubated, which means a tube down into their lungs and put on a machine to breathe. The hospital will say they have too much fluid on board. They're fluid overloaded. Then they'll give them diuretics to try to get the fluid off, and then they'll be dehydrated again. And the cycle continues. And I have seen this with my own eyes time and time again. Now, the hospital is not technically doing anything wrong. They're doing what they're supposed to be doing, which is preserving life. But as we all know, unfortunately, we all die. Right? So sometimes no matter how much you do, that person is going to die. And I think sometimes no matter what you do, if the body is like, no, enough is enough, no matter what you do, it's not going to work, right? So kind of getting ahead of that, right? Knowing that it's natural for your loved one who's at the end of their life to not eat and drink. So you don't have to take them to the hospital to get hydrated. Because if you do, it likely will just cause more pain and suffering. So what can you do? What can you do as a loved one? Here are some tips. Now, when I say we don't need to hydrate the person, I don't mean keep them from drinking water. No, of course, especially if they are saying they're thirsty, or especially if they want food and water. If they are verbalizing that they want these things, go for it. They can have all of the drinks, all the food they want, especially if they are awake enough to do it and they can swallow. Please give it to them. Don't stop them from having these things. What I mean is when they're not asking for it, or they say no, they don't want it, or they're too unconscious to swallow liquid, do not give them anything. That's what I mean. Naturally let their body be the guide. If they're asking for it, great. If they're not, it's okay. Oral care is a really important part of end of life though. So you could always take like an ice chip or popsicle and like rub that around their lips, on their tongue, moisten their mouth so they don't feel like they have a dry mouth, right? Or we give little swabs. It's like a sponge on a stick that you can put in ice cold water, put it in their mouth. A lot of times someone's sucking reflex will start so they can suck on the sponge and get fluid that way, only because you want to keep their tongue moist, their lips moist, and their inner mucosa in their mouth moist. That will be important. So that's something you could do towards their end of life. The one thing I have seen happen that is a little different that I'd like to note is that sometimes people do lose their ability to swallow, like they'll fully lose it, but they're still awake. Maybe not totally awake, but they're awake enough to be able to tell, ooh, I can't swallow anymore. I can't swallow. That actually can be uncomfortable. If their body is not to a place where they're actively dying and they're still conscious, but they can't swallow, right? That's the one time as a hospice nurse that I know it probably is a little uncomfortable if you can't take things because you literally can't swallow. That's the one time as a hospice worker where I do think medication to sedate would be a little more helpful because their body is not in the actively dying phase yet, right? So they are really aware that they can't swallow and that can be uncomfortable. That's the one and only time during this process would I say, and again, you have to talk to your medical provider, but usually we would say they should be more on the sedated side so they don't feel uncomfortable about it. Other than that, most people will not feel uncomfortable about the fact that they don't want to eat and drink. Their body is telling them and preparing, and they go into ketosis, and they usually feel pretty good. So the main lesson here is let the body be the guide. If they want the food and water, great. If they don't, do not force it and let the natural process take over. It will help.